My name is Professor Tim Kendall. I'm the National Clinical Director for Mental Health. So I work across NHS England and NHS Improvement. But I'm also, I chair the Programme of Care Board for Specialist Commissioning. What I wanted to try and tell the audience today, particularly given that they're a group of senior healthcare financial officers and so on, so many of whom are executives, is to try and get them to have a snapshot of what we've achieved with the 5-year forward view for mental health and what our plans are now we've started the new long-term plan. Now, as I'm sure you're aware, we've now managed to win a settlement of about at least 2.3 billion pounds extra for mental health over the next 5 years. So gradually building up to that amount every year. And that's quite a challenge, but it's to really transform the whole way in which we provide mainly community mental health services. So that's both for people who are referred routinely, but also people who are referred in crisis. So I really wanted to try and get all the people in the room to have a good understanding of what sorts of services that we're going to be providing, new ones, but also what the context is, because the NHS is being changed massively. We're all moving towards integrated care organisations and so on. And we've got to just see all this new investment in mental health is at the same time as reconfiguring all of our services. So it's a bit like someone once told me, it's sort of like trying to dance on a moving carpet. So it's complicated. I think mental health is central. When you think of the burden of disease, so what's the life years lost through disability or death from all disease, mental health accounts for 28% of it. Now, at the moment, we only spend just over 10% of the NHS budget on it. So we need to be investing more. And I think everyone agrees with that. So over the next 10 years, there will be gradually an increase in spending on mental health more than there will be on physical health. And it will take time. But when you look at mental health and physical health, it doesn't help to see them separately. Now, we've had for years, you go through one door to get your physical health sorted out. And when you go through that door, everybody's ignored your mental health. Yeah. And that's led to the NHS spending £3 billion a year on people who actually end up not having a physical health problem at all. They've got probably mental health problems, but everyone misses it. And if you go through the mental health door, everyone forgets your physical health. So people with schizophrenia and bipolar disorder currently die aged 60 if you're a man, 65 if you're a woman. So you're losing 20 years of life. And that's because they have undiagnosed problems like diabetes, chronic obstructive airways disease, cardiovascular disease, all of which are a much higher risk for people who've got severe mental health problems. And of course, there's suicide. People with mental health problems do kill themselves. So we're losing an awful lot by having people go in through one door for physical health and one door for mental health. And we want to get to the point where you just go work through one door for whatever you need. So in the long run, if we want to be really radical and change the whole way in which we provide mental health care and physical health care, we'll do it on an integrated basis. We're not there yet, but that's where we're heading. Mental health services of the future will be much more closely integrated with physical health services. We will expect that the community, so neighbourhoods and towns and cities, will provide care for physical health care and for mental health care on a local basis. And what that will give us a chance to do is to get rid of the difference between primary care and secondary care, deliver as much of secondary care as possible now in the community, and you will very easily move from a physical healthcare solution to a mental health care solution, or indeed to have both. So if you look at people with chronic obstructive airways disease, so chronic bronchitis, emphysema, people with that have a much higher incidence of having anxiety. People with diabetes have a higher incidence of depression and anxiety and eating disorders. So whenever people have got a chronic physical health problem, it's quite likely they're going to have a higher risk of mental health problems. So we need to integrate them, and we need to provide our offer for mental health and physical health together. And that's where the future is. The future will be no more primary care, no more secondary care. It will be community-based services, well integrated, backed up by hospitals that will be much, much smaller.